welcome. We're so glad you're here, and it is so nice to see all of you. Some of you I see more frequently than others, and some of you I've never met before. My name is Pam Lane. I'm the Deputy Secretary for Health Information Exchange for California's Health and Human Services Agency and the host of today's summit. I would like to start off by asking those of you who have never attended one of our summits to discreetly, because I know it's embarrassing to start right off by calling you out, but the reason I'm doing that is because I want those of you who are new to these topics in this discussion to be recognized by those who have been around a while. And so if this is your very first summit, would you please just raise your hand so the old-timers in the family reunion will know who the new kids are, and they can help you come to terms with some of the acronyms and some of the terminology we use. Thank you. And wow, there were a lot of first-timers here. Hooray! Welcome. We have a jam-packed agenda for you. I always look at the agenda and think, how in the world are we going to stay on track? How are we going to cover all this material, especially when I want to make sure that we have a little bit of fun and frivolity as we take this break for 2 days from the hard work that we do every single day. So I'm probably going to be the toughest one for the staff to keep on track, but that's too bad. They just have to put up with it, and we're going to just have a good time anyway. We met for the third summit, the third annual summit, just 6 months ago in November here in Sacramento. And here we are again in our first annual Spring and Summer Summit just 6 months later. It didn't feel very much like spring or summer this morning when I got up. So if you want to pretend that you're not in Sacramento and that we're really in Santa Barbara, just go right ahead and do that, because the weather this morning was very reminiscent of my days in Santa Barbara, and we are going to play on a little bit of a spring and summer theme. And once Secretary has come and gone, if she's able to join us today, because you have to kind of behave if your boss is in the room, but once she has come and gone, in keeping with our summer theme, I am declaring this summit to be a serious dress shoe free zone. So if you have brought your summer sandals and your flip-flops, please feel free to change into those a little later. My staff had permission to do that earlier because it would just seem like a fun thing to do, and when you're sitting down, nobody can see your feet anyway. We have a couple of really interesting new perspectives on health information exchange that we're sharing with you today here in our Transforming Healthcare Summit. We really, when we talk about transforming healthcare, we're truly talking about changing culture. And changing culture is never easy. It's always hard. It never goes as quickly as people would like to think that it will. It's very complex, and for those reasons alone, we come together so you can visit, and I know that that's really what you want to do, is you really want to talk to each other. And so we have provided some interesting venues to facilitate conversation for you. I wanted to take this summit from the highest level of technology application to the most heart-tugging, real people perspective of health information exchange. And so I would like to introduce you in this corner of the room to our friend Regina Holliday, who will be the concluding speaker tomorrow. She is a patient advocate, and she uses art to explain the reasons and the rationale and the need for health information exchange in our healthcare environment. She's going to be painting throughout the summit, and she will be painting from the patient's perspective relative to what they hear about health information exchange in California. She has great stories about paintings that she has done, as well as the one she is wearing, because she is the creator of the Walking Gallery. And her media of suit jackets is a disruptive media. It is intended to facilitate conversation, questions, and discussion around the need for health information, technology, and health information exchange. A little bit different perspective. We're delighted that you're here, Regina. She's going to be our concluding speaker because she's going to bring all of this back around to the real patient story of why all of this is so important. Now, on the other far end of the spectrum, we know that there's a great deal of health information data that needs to be turned into usable, consumable analytics, but that in and of itself is challenging because the amount of clinical data that's available is doubling every 5 years. Our brains are not getting twice as large every 5 years. So how does a clinician or a non-clinician, a patient, anyone who needs access to that data to use it to make decisions, how do you take that amount of data and transform it in such a way that you can actually find an answer? And our friends from IBM have an entity, has a personality all of its own named Watson. And we are all familiar with Watson from Watson's ability initially to play chess, because that was mathematically driven, and Watson whooped up on those chess champions, and then Watson played Jeopardy! And Watson is here with us today in a kiosk form because now IBM is making Watson available for processing the vast amounts of health information data to assist clinicians in making patient care decisions. Watson's kiosk is back here in the corner. We thank our friends from IBM for bringing Watson to us today, and you can play Jeopardy! With Watson on our break and at the reception tonight, and talk with them about how Watson Health, I want to call him Dr. Watson, but they're calling him Watson Health, how Watson Health is helping the Sloan Kettering Cancer Institute with patient care, and HealthPoint is also using their analytics and their decision and processing capabilities. So we have two extremes. And somewhere in the middle is where most of us are living today. But we are here to change a culture. We're trying to change the culture of treating illness to a culture where we create wellness. We will still be treating illness. It's part of our world. But it's truly that creating of wellness that we hope to have happen in the years ahead. We're at the vanguard right now of helping transition the healthcare system from an information-poor culture to one where information is rich and available, accessible, and usable. We're talking culture change. We're moving from a culture of autonomy, silos, lack of accountability, and in some cases, downright sheer guesswork, to one that is interdependent, information-rich, evidence-based, and accountable. It's a new culture where we can actually measure and improve quality of care, where we can track which kids have had immunizations, where we can manage the health of populations such as people with diabetes or heart conditions. Isn't it wonderful to be part of this culture change where it's projected that big data, and that's what we're talking about, can save $450 billion a year in the United States in the healthcare system. But it is hard, and we are tired. And I know that you're all out there working just as hard as you possibly can, because this is not just about plugging in computers, installing electronic health record software, and getting wires connected and information on a single screen in a single doctor's office. It's about transforming how decisions are made. about how care is delivered, how patients and clinicians who care for them can interact and communicate. And remember, when we talk about the patients, we're not talking about people that are out there. We're talking about ourselves. If you're not a patient, you will be. I remember seeing a sign in a hospital social services office many, many years ago that said, aging, if it's not your issue, it will be. Healthcare, if it's not your issue, it probably will be. So we are the patients. One of the challenges that we're going to face in the days and years ahead is the workforce challenge, because it isn't just about plugging in and installing computers and electronic health records. When I started as a health record professional many more years ago than I will admit, the big challenge was filing loose pieces of paper, and that's actually how I started as a clerk in a file room. But medical records professionals don't need to do that so much anymore. They're not particularly at a paperless place. In fact, many of you who have current experiences with electronic health records know that you're now printing more paper than you were before. Because as soon as somebody says, oh, I need a copy of that record, here, let me print you one. And they turn around and hit the printer. But the challenges for the workforce skills are going to be different in the years ahead. And the workforce necessity for changing of skills is probably not going to occur as quickly as the slope of the need is going to increase. So those are challenges we're going to face. We know that one of the programs that the federal government has funded under HITECH was workforce development, and they quickly realized that it was not so easy to teach healthcare to an IT professional, that perhaps they should be teaching IT to healthcare professionals. Healthcare has its own language, its own quirks, its own workflow, and it's a little bit more complex than some folks who haven't been in it realize. It's created some interesting challenges in workforce development. Our co-sponsor for today, one of our co-sponsors, is National HIMSS, and they are working with us and will continue to work with us. In fact, we just had a conversation about how we could work together for workforce development. Once you get past those IT skills, the skills of leaders of tomorrow are the same that they've always been: managing, protecting, and releasing information appropriately. It's a culture change. Analytics is going to intersect and is already beginning to intersect with our world, the other HIE. The Health Insurance Exchange is that other one that's getting all the attention right now, but I love it when we're referred to as, oh, you're the other HIE. Yeah, we were the first one. We're the one you need to make yours go, but we will consider ourselves the other HIE for right now. On your tables, there are some stickers, and I want to tell you what the stickers are for, because you know when you get in a room with me, there's going to be some quirky takes on what's going on. You're going to be allowed to wear flip-flops. I'm going to try to make some fun things happen in your day, and one of the things that I wanted to have happen spun off of this report, and you've probably all seen it. There are some people in Washington who have said recently that we need to reboot the HITECH dollars, and the HITECH programs need to be recalibrated because they think it's not working. Some states have closed their HIEs and given back the money. We have not done that in California. We're not going to do that in California. But perhaps there's skepticism. The word that I heard used before I started speaking was the stench of those failures. Perhaps the stench of those failures really is true. But no one said this was going to be easy, and no one said this was going to happen quickly, or that it wouldn't require trial and error, or that $38 million, a mere fraction of what we spend in California on health care in a single year, would get us from the start line to the finish line. So when one of my staff read the report, they said to me, you know, that really made me angry. I think the word they used was mad. That really made me mad. I kind of took that like they were daring us to be successful at this. In fact, it felt like a double dog dare. So what you have on your table are double dog dare stickers. Now you'll notice that the dogs have happy smiley faces. But these are for you to remember that we've been double dog dared by Washington to be successful in California. And I'm going to double dog dare you to put a sticker on and share something that you're doing in your part of the HIE world that may be a little different or a little unknown to the people that you talk to during this summit. You feel free to take stickers back and double dog dare your staff to think outside the box, to come up with a different way of doing this, because this is different. We have to come up with different ways of doing this. What we've always done is not working. It's not working financially. It's not working in the best interest of the patients. Oh, and who is the patient? That would be me. It's not working in the patient's best interest, and it's not going to be feasible for this to fail. We cannot continue down the road in which we've been going. So I double dog dare you to have fun while you're here, to interact with people that you don't know, and to help figure out how we're going to make this happen. So what's been happening in California in the last 6 months, since last I saw many of you in a room at a summit? A lot's been happening. When we met 6 months ago, we were talking about something called the Western States Consortium. And those of you who get email blasts from me on a basis of twice a month or so have been kept up to date on the Western States Consortium and how additional states have joined and as the activities have gone forward. And I want to tell you that the Western States Consortium is no more. What did she say? Well, they're no more because they have become the National Association of Trusted Exchanges. They have been incorporated in Washington, D.C. as a nonprofit, and California continues to take the lead in the board activities to move forward with the efforts around interstate. That's across state lines, if you have to think about that for a minute, because sometimes I have to go interstate. Oh yeah, across state lines. Exchange of patient data for patient care. We are exchanging information, California and Oregon. There are 8, somebody help me here because I'm drawing a blank on how many states are now in. Where are my staff? Dave's counting for me. He's going, no, Utah, Nevada, Hawaii, Alaska. There's a bunch. And they're not just Western states. We talked about this. We joked about this in November. Michigan, Florida. I don't know if it's just the western side of those states, so they could be the western states. I'm not quite sure. But they're engaged and involved and very interested in what we're doing to help set standards for governing interstate exchange of patient data. One of the organizations that has come into being is a new governance entity for California. What? We haven't heard anything about that. Well, no, you haven't, because it has occurred in the last 8 weeks. Here's another new acronym for you. We pronounce it CAHIE, but it's actually CAHIE, and it stands for the California Association of Health Information Exchanges. Very exciting work. We talked in November about the growing concern that we had with a gap between health information organizations, enterprise, and community, and how they needed to exchange data to connect all of this together, and the gap was getting broader and broader. We had 14 community and 13 enterprise, or perhaps I just reversed them, but there were that many of them, and they were not exchanging. There were no plans, there was no agreement on how they could exchange data. So what happened 8 weeks ago was my staff facilitated a meeting. It was phenomenal. It was one of those meetings that if you'd tried to imagine what it would look like, you couldn't, because the leadership from enterprise and community HIEs came together in a room, took a day away from their work, agreed to not tweet, not email, close the doors on the room, sit at the table, and figure out what it would take for them to trust each other and begin to exchange information between HIOs that didn't look like each other. It was a class, and I, by the way, stepped away from the table and went like this all day, because I wanted them, those who were doing it, not those who are reading about it and talking about it like I am, but those who are actually doing it, to say what it would take. And they came out of that room with leadership, with a charter, with a plan, with follow-up scheduled meetings, and you will hear tomorrow more about CAHI and the California Association of Health Information Exchange and their efforts to create a trusted environment. We've also created the second version of the Model Modular Participant Agreement. I always say that wrong. I got it right. Woohoo! Thank you for nodding at me. Yeah, she did it right. Some of you were in a breakout session and a pre-session and heard much detail about that. That is out there now. And we also have a draft authorization tool that we are asking the community beginning today to comment upon. The draft authorization tool is a decision tree. And it has to do with helping you make decisions of when you need patient authorization to share clinical information for patient care purposes. That doesn't seem like we should have to have authorization for patient care purposes, but California and federal law do not always agree completely, as you know, and there's a new tool on our website we'd like your comments upon, and that is the authorization tool. It's out there for your review and comment. We also, in this past 6 months, have combined our previously separate privacy and security steering teams into one stakeholder steering team advising on policy to my office. And I do want to point out to you that there is a table. Fourth one, they're raising their hands. The Cal OHI table over there will show you, has a number of materials for you, will show you where to find all of these materials on our website. My staff, as you know, are dedicated to providing tools for you, so you'll have tools in your hand and you can make these things work, make these things happen that are so important. I know I'm already over time because that's what I do. I do want to take a moment and thank all of our sponsors whose tables are around the room. We did things a little differently this time. We don't have a level breakout for our sponsors, but you will find a wealth of materials around the room, and I would please ask you to visit with those folks and thank them for sponsoring our event. I'm sure I've forgotten 47 other things that I'm supposed to tell you, but I'll be with you for 2 days. And I double dog dare you to not come back and find out what's going to happen later on in today and tomorrow. With that, I'm going to remember that I'm supposed to tell you that we do have free internet access for you if you haven't already found out in this room. You can set up your connectivity, you'll get the prompt, and you can proceed through those items appropriately.